Hey everyone, this is Marcos with the Hunter First Aid YouTube channel. I'm an emergency room nurse and paramedic specializing in remote area and wilderness medicine. Today we're starting a series covering common injuries that you may encounter while hunting. We're focusing today on minor abrasions and minor lacerations, what they are, and how you can take care of them in the field. Let's go. In today's video, we are going to be reviewing minor abrasions and minor lacerations. But before we can do that, we have to understand some basic anatomy about our skin. Our skin is the largest organ of our body. It covers our whole body and can very easily be hurt when we're out hunting, crawling, climbing, going over barbed wires, whatnot, dealing with broadheads and knives. Our skin can very easily get injured. So let's talk about the skin first. Our skin has three layers. You've got your epidermis, which is the outer layer, your dermis, which is the layer underneath that, and your deeper layer, the hypodermis, which contains fatty tissue. So what we're going to be talking about today with minor abrasions and minor lacerations is really going to only involve that epidermis and dermis layer, that top layer, and that second layer. With these injuries, you might get no bleeding at all. You might get some bleeding. Depending on the location, you might get more bleeding than you expect, but generally these are not life-threatening injuries. So let's just jump right into what is a minor abrasion. A minor abrasion is most simply defined as a scraping or a rubbing off of that outermost layer of skin. It might go into that second layer, that dermis layer, but mostly it's just that outermost layer of skin. You're going to do this when you're crawling on the ground. You can do this when climbing over fences. You take a tumble and you fall, you put your hand out, especially if you're hunting in warmer weather, you've got more skin exposed. You're going through thick, rough, so there are many chances that you can get a minor abrasion while hiking. It's important to treat these as quickly as you can in the field just to avoid getting infections, and that's going to be the same with the minor lacerations. So with these abrasions, although minor, generally they don't bleed. If they do, it's very, very little. You're going to want to clean them out right away. And we'll go over the treatment plan here in a second. But the other thing we're covering today are minor lacerations. A laceration, in its simplest definition, is a tear or a cut to tissue. What we're talking about today is a minor laceration, so it's going to be more of a skin laceration that will involve that epidermis, that top layer, and possibly that dermis layer. Now, these will generally bleed a little bit more than those abrasions, although there are times where they don't bleed at all as well. Kind of like a paper cut. That don't go deep enough to actually cause any bleeding, but they still hurt. But most of these will bleed a little bit, and I would actually encourage bleeding to help clean them out. Now, depending on the location and the size of these lacerations, you may need more attention than just the basic first aid we're covering here. But what we're focusing on today are the minor lacerations that you can treat in the field pretty readily and get really good results with. So with both minor abrasions and minor lacerations, you might get no bleeding, you might get minor bleeding, and I would actually encourage some bleeding to keep debris out, to help push debris out. Now, in terms of treatments, we're going to start with very, very basic treatments. You're going to first want to irrigate the wound, which means cleaning it out with water. I highly recommend carrying soap with you. I always carry soap in my first aid kit because most of these minor injuries that break the skin can be cleaned out with soap and water, and that's really most of what you need. Now, if we're looking at an injury which we would call in the medical field grossly contaminated, which means it's got a lot of debris in it. It wasn't just a clean cut. It might have dirt in it. You might be going over some railroad ties on a fence that have got the oils in it. Anything like that where it's got stuff in the wound, you're going to want to not only do the soap and water, but we'll talk about antibiotic ointments as well. So with soap and water, I would highly recommend antibiotic soap. I personally carry soap that my wife makes at her store, littleleaffarms.com, that is specifically for hunting. It's non-scented. It actually absorbs scent, because the last thing you want to be using is a scented soap that's going to give away your location when you're just trying to wash out a simple little wound. So unscented soap, water. If you don't have running water that you can use your bottled water. I would most recommend clean water, bottled water, filtered water. That's going to be really your best choice when it comes to cleaning out these wounds. If that's not an option, then running water. You do not want to use still stagnant water to clean out wounds. You're only going to be introducing more bacteria to the wound. Another thing to consider is using pressure behind your water. I usually carry 10 cc syringes with me with sterile water in them, but that's more of a medic thing, nurse thing. You might not have that. But using a 10 cc syringe, you could pick them up online, on Amazon, on wherever you shop. They're pretty easy to find. But if you don't have that, you can use like a bicycle water bottle, those water bottles with the drinks that you can just squeeze out of the end, get some more pressure out of. Or you can even just poke a hole in the top of a water bottle that you pick up from the gas station, and that's going to give you enough pressure to clean out that wound, get any debris that's stuck in there out, and try to wipe away whatever you can as well. After soap and water, dry it, cover it with a bandage. Any kind of bandage will do. Generally, you don't want a waterproof bandage unless there's an absolute need for it. We're going to do a separate video when to use waterproof bandages, how to use them. You want something that's going to breathe, that's going to help that wound heal. So if you don't have just a regular, bandage that you can use, like Band-Aid or something like that, even I generally use just gauze and athletic tape. Works really, really well. It breathes, it keeps debris out of it. You can also use antibiotic ointment. I recommend bacitracin. Generally, I stay away from triple antibiotic ointments for certain reasons. Again, we'll review that in a different video. But any type of antibiotic ointment that you use will be fine. I use it if it's a grossly contaminated cut or wound. Also, I'll use it if after a few days I see that the wound's getting infected. So I'll then put it on for a couple days, 2 or 3 days, and that usually takes care of any minor infections. So what are we looking for after we've cleaned the wound with soap and water? We've covered it, we've continued on. We want to make sure that that wound stays clean. What we don't want is for it to get infected. That's why we're doing this. If it gets infected, that could be trip ending if not treated, and I've seen this happen after only 2 or 3 days, where somebody gets septic, which is the infection spreads to your body. You can get really, really, really sick, and that will put you in the hospital. That's what we're trying to avoid. So clean with soap and water, cover it up, keep it clean. If it starts to get infected, what you're going to see is swelling, continuing redness. Now, keep in mind, you did just injure your body. It's going to swell, it's going to hurt. You're going to have that anyways, but this is out of proportion. That redness continues to grow, the pain continues to grow, the swelling continues to grow. You're going to see leaking out of that wound, so it's going to start weeping fluids that are either pus, green, yellow, different color fluids. It might start to smell. You could also get what's called streaking, whereas the infection starts to spread through your veins, and so those veins start to turn red, and it looks like streaks coming from the wound. If that's the case, you're already pretty infected. You're going to probably want to go to an urgent care for some antibiotics or something like that. We're trying to avoid getting to that point. So if you feel any type of additional swelling, pain after a day or two that you feel shouldn't be there, you start to see some pus, you're going to clean it out. You're actually going to want to reopen that wound a little bit to clean that pus out, clean it out, add that antibiotic ointment, cover it back up. Hopefully, you treat it in the field right when it happens. You get your water bottle out, you get your non-scented soap, you clean it out right there, you throw a bandage on it, you're good to go. When you get back to base camp, you've already forgotten about it, and it's already starting to heal. And that's the whole goal, is that this isn't trip ending. It doesn't make your trip miserable, that you know how to treat a minor abrasion, minor laceration, not only for yourself, but for your buddies when you're out there hunting. So in review, we've covered minor abrasions, minor lacerations. What are they? An abrasion is a scuffing or a ripping off of skin, usually that outer layer. That laceration is going to be a tearing or a cut into that outer layer of skin, possibly into that second layer of skin. Treatment for both is the same: soap and water. Make sure to get it clean. Cover it, dry it up, cover it up with some kind of bandage. If it is grossly contaminated, then you're going to use an antibiotic ointment. If not, soap and water will do the trick just fine. Cover it up. Keep an eye on it over the next few days. If it seems like it's starting to get infected, use some antibiotic ointment. Keep it covered up. Once that scab's over, you're good to take that bandage off and let it heal on its own. Thanks for watching, everyone. Be sure to like and subscribe so that you are notified every time we upload a new video. Comment down below what other topics you'd like us to discuss, and we'll make sure to get them up there for you. Get out there, get exploring. Remember, safety is no accident. All right, see you on the next one.